The topic for the day is Cangrelor myth, misconceptions. So I want to start with the question, very simple questions. Before Cangrelor was available, we had clopidogrel. We have patients with MI or PCI or ACS. We put them on clopidogrel. And then Champion Phoenix trial came along. Can you tell me, when you heard the result of the Champion Phoenix study, what was your reaction to it? Were you a positive reaction, negative reaction, had questions? Can you tell us the story when you heard the result of that study?
Well, thanks for that question. It was sort of an interesting scenario. It doesn't just come with the Champion Phoenix study. It's a big story. First of all, it's important to understand that Cangrelor, an ATP analog that is directly acting and is very fast onset, very fast offset, with fantastic greater than 98% platelet inhibition, is really an exciting reversible P2Y12 binder. It binds it in a reversible way with a half-time of about 3 to 6 minutes. And pretty much all the platelets, if you stop about an hour after, everything is back to normal. So almost like a holy grail of antiplatelet therapy. You turn it on when you want it, you turn it off when you don't. And doesn't that sound like a beautiful thing to do? And so in PCI, Cangrelor was examined not just in Champion Phoenix, but before that, there was a platform study and a PCI study. Both of them went up against clopidogrel because that is, as you said, what we had. In Champion PCI, it was really stable angina, STEMI, non-STEMI. It was sort of anybody undergoing PCI. It was placebo versus clopidogrel at the start of the PCI. And then, of course, the patients who were randomized to Cangrelor received the bolus and then an infusion. That study didn't meet its primary endpoint with reduction of MACE, the hard endpoint. Then there was this Champion platform study. Both of them were kind of going on at the same time, over 5,000 patients, and that was in stable and non-STEMI, non-SD elevation ACS. And there, it was the same, very similar, versus 600 milligrams of oral PCI. But remember, those patients who underwent PCI had nothing on board, whereas Cangrelor was infused immediately at time of PCI, and it was post-PCI that they received their clopidogrel. So there were some issues where you were like, well, the clopidogrel arm was disadvantaged. So then we moved to Champion Phoenix, which was a very, very interesting study, also with stable angina and non-ST elevation MI and STEMI. And these were patients who were naive to P2Y12 inhibition. They were given either placebo or clopidogrel at the start of the procedure. And the arm that received, the active arm, though, received Cangrelor bolus at the start of the procedure, and then an infusion of Cangrelor. And then a switching off to clopidogrel again, because still we didn't have prasugrel or ticagrelor, as you said. That study, with its endpoint that was a 48-hour endpoint, that also included not just death, MI, or stroke, but it actually had procedural 48-hour evaluation of acute stent thrombosis, procedural stent thrombosis. And that was any kind of a clot formation at the time of the procedure. And interestingly enough, the endpoint was very positive. So you say to yourself, wow, well, this stuff works if you give it to the patient who doesn't have anything else on board and is only getting 600 of clopidogrel at the start of the procedure, but it really is a week. It takes a long time for clopidogrel. It's basically going up against nothing. So yes, I was very excited to say, well, if you give a potent agent at the time of PCI, it should work. And it really did work. So it's a long answer to your short question. I apologize, but I think it's important for everyone to know every single thing that went on with Champion Phoenix.
Yeah, I mean, thank you for summarizing it. I think you're absolutely right. When a landmark trial comes out, we forget the route that got us there. And I think it's important